Good day, everyone. Today we're going to learn about Ida Jean Orlando Pelletier's nursing process theory. In this presentation, what we're going to talk about is first, Ida Jean's biography. Second, the nursing process theory. And lastly, the four meta paradigms. Ida Jean Orlando was born on August 12, 1926 in New Jersey. She was a first-generation American born from Italian immigrant parents. In the year 1947, she gained her diploma in nursing from the Flower Fifth Avenue Hospital School in New York. In the year 1951, she graduated with a Bachelor of Science degree in Public Health Nursing from the St. John's University in Brooklyn, New York. In the year 1954, she received her Master's degree of Arts in Mental Health Consultation in Teachers College, Columbia University. In the year 1954 to 1961, she was an associate professor and director at Yale University. She was also a principal investigator of a research project called Integration of Mental Health Concepts in a Basic Nursing Curriculum. She surveyed over 2,000 nurse-patient interactions. She also published her first book, The Dynamic Nurse-Patient Relationship. In the year 1962 to 1972, she was a clinical nursing consultant at McLean Hospital. She initiated an educational program based on her nursing model. She was also the first psychiatric nurse in the US to receive a research grant from the NIMH. In the year 1973 to 1984, she served in the board of the Harvard Community Health Plan in Boston. She was also an educator at Boston University School of Nursing. In the year 1984 to 1987, she held administrative position at Metropolitan State Hospital. She was also an assistant director of nursing for education. And lastly, she was a project consultant for the Mental Health Project for associate degree faculties. In the year 1992, she retired and received the Nursing Living Legend Award by the Massachusetts Registered Nurse Association. And in 2007, Orlando died on November 28, 2007, at the age of 81. Now let's talk about the nursing process theory, which is a deliberative nursing process theory. Background of the theory. Orlando developed the theory from a study conducted at the Yale University of Nursing. She also integrated mental health concepts into a basic nursing curriculum and analyzed the content of 2,000 nurse-patient contacts and created her theory based on analysis of these data. According to Ida Jean Orlando, patients have their own meanings and interpretations of situations, and therefore, nurses must validate their influence and analyze with patients before drawing conclusions. Now let us discuss the concepts of the nursing process theory. First, the theory stresses the reciprocal relationship between patient and nurse. Second, the participation of patient is critically important in the nursing process. Third, all patients' behavior can be a cry for help. Fourth, it is the nurse's job to find out the nature of the patient. Fifth, dialogue between the patient and the nurse helps the nurse find the cause of distress and how needs may be met. 6. The deliberative nursing process allows nurses to formulate an effective nursing care plan. These are the stages of nursing process theory. First is the assessment. Second is the diagnosis. Third, planning. Fourth, implementation. And fifth, evaluation. Now let us discuss the stages of deliberative nursing process. First stage, assessment. A nurse completes a holistic assessment of the patient's needs. It also utilizes nursing framework to collect both objective and subjective data about the patient. Second stage is diagnosis. Nurses use their clinical judgment about health problems. Diagnosis can then be confirmed using links to define characteristics, related factors, and risk factors found in the patient's assessment. Third stage is planning. It addresses each of the problem identified in the diagnosis. Problems are given specific goals, and each goal is given nursing interventions to help achieve it. A nurse will then have a nursing care plan. Fourth stage is implementation. The nurse begins the nursing care plan. Nursing care plan is put into action. Lastly, evaluation. In this stage, the nurse looks at the progress of the patient towards the goals set in the nursing care plan. Changes are made to the nursing care plan depending on the patient's progress. New problems are addressed, then the process starts over again. These are the concepts of the nursing process theory. Function of professional nursing. It is finding out and meeting the patient's immediate need for help. Presenting behavior. It is a patient's problematic behavior that reflects the stress when the patient experiences a need that he cannot resolve. Immediate reaction. It is the internal and immediate automatic thought, feeling, and action response of the patient. Nurse's action. It is the automatic nursing action, the action acted upon other than the patient's immediate needs. Deliberative nursing action decided upon after ascertaining a need. Nursing process discipline. It is the investigation into the patient's needs and the nurse's appropriate action to resolve the need in cooperation with the patient. Improvement. It is the resolution of the patient's situation. The result of the nurse's action are evaluated to determine whether the action served the patient's needs. Now let us talk about the meta-paradigm of the nursing process theory. Human being or person. This is the focus of nursing process. Humans with unmet needs. Health. It is a sense of helplessness as the initiator of a necessity for nursing. Environment. It is the disregarded environment in her theory, focusing only on the immediate need of the patient. Nursing. A unique and independent profession in its concern for a human's need for help in an immediate situation. In conclusion, Orlando's theory remains the most effective practice theory that is especially helpful to new nurses as they begin their practice. Orlando's nursing theory stresses the reciprocal relationship between patient and nurse. Orlando's theory focuses on how to produce improvement in the patient's behavior. Also, evidence of relieving the patient's distress is seen as positive changes in the patient's observable behavior. Lastly, Orlando may have facilitated the development of nurses as logical thinkers. And that is all. Thank you. I hope you learned something from our presentation.